friends. Today we are going to dive into an important topic, motivation and change theory. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about motivation, how to bring in change in the behavior. Hence, I'll be discussing about change theory. Various theories of motivation will be discussed, and importance of motivation will be addressed in this video. Motivation is the internal or an external drive. It can be force that initiates, directs, and sustains goal-oriented behavior. Motivation is inherently dynamic, fluctuating both between individuals and with the same individual over a time. Motivation is dynamic in nature. It can be enhanced, it can be maintained, and it can be counteracted by doing certain activities. Let's look at the components of motivation. Here, a person who does not want to change his behavior, for example, he does not want to lose his weight, we need to do activation. That is, the decision to initiate a behavior or an action to lose his weight. That is activation. Persistence. Just because somebody is activated does not mean he will maintain that behavior. Hence, there is a need for persistence, the continued effort towards a goal despite challenges which are seen. Intensity, the level of efforts and focus put into achieving that goal. Hence, my dear friends, in this contemporary world, motivation plays a crucial role with respect to lifestyle behavioral changes which have to be adopted. And we need to bring in goal-directed behavior to change these lifestyle behaviors. For example, sedentary life, the person who does not do any exercise, getting up early, internet addiction, smartphone addiction, alcohol addiction, tobacco dependence. There are many lifestyle behaviors which needs to be changed. In this regard, motivation to change by activation, maintaining that motivation by adequate intensity to change the behavior which is required. Let's look into various motivation which plays a very important role to change the goal-directed behavior. For example, a person is obese. He needs to lose weight. Just by advising, he will not be able to choose. We need to handhold him, motivate him, make sure the motivation is maintained at the adequate level, and see to that he will maintain that behavior to lose weight and also make sure he does not relapse. Similarly, with regard to internet addiction, these behavioral addiction also needs to be done by motivational interview or by motivational enhancement therapy. With regard to alcohol, insomnia, depression, and with regard to borderline personality disorder, person who has cancer refusing treatment, we need to do motivational interview. And finally, with regard to marital discord, both the couple may do not want to undergo marital therapy. In such scenario, we need to bring in motivation to undergo change. Now let's understand what is motivation. Invariably, the doctors or the therapist want to bring in certain changes in their clients or the patient. Invariably, they think the patient, when they are brought to the hospital, they are ready, willing, and able to change. This is the default thinking. Many a time the doctor will advise, stop smoking, stop taking alcohol, do exercise. These kinds of advice may not bring change, or invariably does not bring. Often patients are expected to do all the doctor says, but invariably it doesn't happen. The simple reason is motivation to change will be very poor. By simply advising the patient or the client, do not expect any change. So, how to bring in change is a big question to the doctors who are dealing with chronic physical disorders, non communicable disorders, which are directly dependent on lifestyle behaviors, alcohol use, internet addiction. So, such behaviors need to be changed. So, how to change? In this regard, we need to understand change theory. Here, replacing one pattern of attitude, behaviors, thoughts, and feelings with another, which will bring in the required behavior. Please understand, change is the only constant. Many a time, the person believes, yes, being in that comfort zone is the only way to go. Invariably, being in this comfort zone will not bring in any change in his life or the growth. In this regard, James Prochaska and DiClemente, 1972, discussed the Transtheoretical Model of Behavioral Change. This model views behavioral change as a gradual process and not one-time process. Let's look into this diagram. Here, you can see the pre-contemplation. That means he is not aware, he is in denial, do not want to change any behavior. That is pre-contemplation. Next is contemplation. He is aware of his behavior, but however, he does not have committed to change. That means awareness has been brought in. The third one is preparation. Here, now he wants to bring in changes. So intent to change is there. Now the discussion starts how to go about. Invariably, the action starts in. Modification in the behavioral will be the important step here. And then maintenance of this behavior. After some time, invariably, there will be relapse. However, although these steps appears to be one after the other, invariably, they overlap each other. Many a time, a person who is in pre-contemplation may suddenly jump into an action without even going to contemplation and preparation. In this regard, there will be many lapses. Relapse is full-blown, complete. Syndromal diagnosis comes in relapse, whereas lapse is one or two drinks or one or two lapses. For example, a person wants to lose his weight. Here, he is contemplated, he had prepared, he started going to gym. Almost 1 week he is regular, and suddenly one day he does not go. That is called as a lapse. That is one lapse behavior. Then again you start with pre-contemplation, contemplation, preparation, action. Many a time he may not go for gym for months. Then it is called as a relapse of his old behavior. In such scenario, we need to again start with pre-contemplation, contemplation, preparation. So this is what the Prochaska and DiClemente talked about. That is trans-theoretical model of change, which occurs in various steps. And the therapist or the doctor should know it's not a one advice which will bring in changes. Hence, my dear friends, we need to know in what stage the client or the patient is. Is he in denial phase, not seeing it as a problem, especially a person who is drinking alcohol? He denies he does not have any problem. He takes alcohol once in a while. In contemplation, he starts thinking, yes, there is some issues which are occurring because of alcohol use. Now, he will make efforts by gathering information either through internet or consulting a doctor or a counselor. Once it is done, he will now put into action. He will not take alcohol so that he wants to quit the alcohol. And then over a period of time, he stops alcohol. That maintenance of that behavior is very essential here. But invariably, this motivation what are the change which has occurred may not sustain for long duration, there will be relapse. In such a scenario, you need to start from the beginning. So one is relapse, another one is lapse. Lapse is one or twice going back to the behavior. Relapse is a complete full-blown going back to the behavior. So my dear friends, all the doctors and therapists who want to bring in lifestyle changes need to understand about the change theory. So with this, we will now look into this important steps, the change theory. Pre-contemplation, the person does not see it as a problem. Contemplation, yes, there is an ambivalence. Yes, this behavior is causing certain problems, but not sure. But he wants to change in this preparation phase by gathering all information with regard to his behavior. What are the positive aspects of continuing with behavior? What are the negative aspects of giving up that behavior or starting a new behavior? Hence, he will decide and he will take action. And finally, the maintenance phase. Invariably, in these steps, there will be lapse, that is a brief or a temporary return to previous unwanted behavior. Relapse is a full blown return to the old behavior. Often, lapse and relapse do occur because human is a human. Invariably, there will be error, there will be decrease in motivation. As I mentioned earlier, motivation is dynamic in nature. Hence, we need to accept this and look for lapse and relapses. So if you look at this transtheoretical model for stages of changes in pre-contemplation, there is completely no denial of the problem. In contemplation, there may be a problem. And now in preparation, he starts gathering information, consulting people, and finally he starts action, doing it. And the maintenance, invariably, try to maintain in that behavior. And invariably, very few people will maintain for longer duration. 90 to 95% will have relapse. Hence, we need to prepare for relapse also. Now let's look into the other theories of change. One is Maslow's hierarchy of needs. It starts with physical needs. A person who wants water, food, and shelter invariably wants to go for work so that he gets money to buy food. Safety needs. Since he is working, he also wants to have health insurance, or else he would like to have a house, to build a house so that there is a security. Social needs. He needs to be accepted in the society, belonging, family, or the work group. So that is the social need. Third one is self-esteem needs. Respect from the community, reputation, being in the group, and also moving up the ladder at the workplace. And finally, self-actualization. Doing work for his fulfillment, for his consciousness. And this is called as Maslow's hierarchy of needs. The other important is self-determination theory. Invariably, humans' three basic needs are there. One is autonomy, need to control of his own body and behavior, thoughts, and feelings, so that he will determine where to go, how to go, and when to go. That is autonomy. Competence, whether he has competence to do certain work or dealing with the environment, dealing with the challenge. If he does not have competency, he will avoid. Invariably, the laziness and procrastination is seen when the competence is not there. The third one is relatedness. Need to have a close, affectionate relationship with the friends, family. That self-determination theory plays a crucial role, having these three important variables. Moving to expectancy and value theory. Value construct is, why should I do this task? What will I get by doing this task? Is it the money? Is it the recognition? Will it pass the exam? So these are the value construct. Expectancy construct is, am I able to do this task? That is, competency comes in picture. Although there is a value construct is there, if you are unable to do that, you are unable to understand how to do it. So this is expectancy and value theory. Drive reduction theory. Here, Every human being wants to be in homeostasis. Invariably, the lack of homeostasis leads to need, need leads to drive, and motivation to act so that there is a homeostasis. So, this is again a drive reduction theory plays a crucial role. For example, everybody wants to be in homeostasis, but unfortunately, the thirst comes in, thirst or hunger. So, there is a drive to quench the thirst or an hunger. Action is you need to have money or you need to work so that you can get fluid or food to eat. And finally, by doing certain activities, you will be able to quench your thirst. So, this is drive reduction theory plays a very important role. So, it revolves around the basic needs as Maslow's considered. The next one is incentive theory, which occurs in the contemporary world. Here, motivation is influenced by reward and punishment. Either by the reward, he will do certain activities, or if he does not do activities, there will be a punishment. Hence, combination of this will lead to incentive theory. And finally, intrinsic and versus extrinsic motivation. If the person is in pre-contemplation, there is he does not want to do any activity. There is a complete denial of a problem or does not want to change. The next one is extrinsic. That is, he wants to please others, or else he wants to reward, that he wants to get first rank. So there is an extrinsic, there is a motivation from the external. External means outside the human being. That is, requirement of praise, requirement of money, salary, award, first prize. They're all extrinsic. But the highest motivation is intrinsic. Intrinsic, I need to do good to the people around me. That is done for the inherent joy of giving to others. That when it starts, intrinsic motivation, the person is matured, it does not require any extrinsic motivation, and it's a self driven nuclear energy kind of thing, which is intrinsic, that is inherent joy for helping others. Now let's understand how motivation works in real world. In real world, you can see in this graph, you can see in the x-axis there is motivation. At the lowest point, it is low, and as you see, it goes up high with the motivation. On the y-axis, you can see the time. The motivation does not remain constant, it fluctuates. At one point of time, your motivation will be on the top notch. If things do not go in your favor, if there is a competency issue, or you are not rewarded, or you feel that somebody is coming in your way, it may go down. So the motivation fluctuates. Invariably, there are opportunities to bring in change when the motivation is at the top notch. Then the things move. At the same time, there are dips or there are fluctuation or the motivation decreases very badly. In such a scenario, you may not take any action towards change of behavior. Hence, you need to understand this. If a person who is drinking alcohol, once the motivation is very high, he will quit. And unfortunately, if there are any challenges in his life, stress, invariably the motivation dips and he will go and drink alcohol. So this can be extrinsic or intrinsic. Extrinsic, invariably poor coping skills leading to relapse. Intrinsic is invariably he wants to feel good. So in such a scenario, you need to understand the lapse and relapse is common in human behavior. Do not expect him to behave like a robo. And if you expect like a robo, invariably you will be disappointed, frustration will come in, and invariably you may abuse that person who is taking alcohol because of his poor motivation, and the relationship will break. If you expect this fluctuating motivation, then you will understand there is a lapse and relapse. Hence, you need to handhold him whenever there are dips or there are notches, or what we call it as whenever there is a relapse, and then take him to the motivation level. So this process takes a long time, and invariably, the day will come, he will be able to quit the alcohol. In this, again, diagram, you can see, in reality, the motivation fluctuates. Whereas the doctor's expectation, family's expectation, society's expectation is green line you can see there. That does not happen. Very rarely, out of 100, one or two patients may go similar to the expectation, where their motivation is strong, good family support is there, and invariably the motivation remains constant over a period of time. However, in human beings, it fluctuates. And hence, in reality, expect relapses so that you can bring back them for the treatment and therapy. So, my dear friends, do not expect a person who is undergone treatment once by inpatient that he will quit. Invariably, there will be relapse. That is the rule of thumb in addiction behavior, or else even in lifestyle behavioral changes. So, invariably, the motivation fluctuates. However, whether a person is highly disciplined, then he'll be able to maintain the changes in his behavior. So, infrequent follow up may lead to fluctuating motivation. If a person has frequent follow up, the discipline is well maintained, and invariably, there is high possibility he will quit. If you look at the literature, the scientific literature clearly states that one predictor which clearly says that a person will quit alcohol who is in constant touch with the treatment provider. It can be a doctor, it can be a nurse. Hence, being in touch with the treatment team, there is a good outcome with regard to substance abuse. To summarize, my dear friends, motivation is dynamic, and the key to change is by behavioral change can occur through this motivation. Motivation can be enhanced, influenced, and maintained by having a constant touch with the therapist or with the doctor. The motivation does not improve by lecturing. By default, all counselors and doctors wants to give lecture and advice and try to fix the behavior. Unfortunately, it is not going to happen. Invariably, the person who is using alcohol, many people would have given him lecturing. Many would have confronted his behavior, but he has not quit. By doing this lecturing, you will be one of the family member, and hence the therapy will not work. Hence, we need to bring in a different set of skills with regard to motivation interviewing and making sure that he quits. Hence, the motivation you need to activate, enhance, influence, and maintain. If you are able to bring in external motivation, it will be invariably temporary in nature. For example, if you don't drink alcohol, you will be given this amount of money, or you will be giving the elevation in your job. That is extrinsic. If the person wants to quit alcohol for his own betterment and is an intrinsic drive that is permanent, invariably, and this results in change of behavior. To do this, you need to have, as a therapist or a doctor, you need to have empathy. You need to give autonomy to the patient so that he will decide how his course of action takes. And invariably, as a doctor or a therapist, you need to be supportive. That means unconditional acceptance is very important. Do not reject because he is using alcohol. Do not reject him because he is not being responsible. In motivational therapy, the three important ingredients is empathy, giving autonomy to decide for himself how he would like to achieve his goals in his life. And as a therapist, you need to be having unconditional acceptance, and be supportive to him. Now let's understand this motivational interview. Motivational interview is a client-centered directive therapeutic technique to enhance readiness to change by helping the clients to explore and resolve ambivalence. Here, motivational interview, many authors have considered as a technique or a skill. Recent researchers say it is a way of approach in counseling. It is developed a way to help the person to work through his ambivalence to change or to his resistance. So, either it can be a technique or it can be a skill or a way of approach to do counseling to change his lifestyle. If you look at this motivational interviewing, and it's an evolution of client-centered therapy. It's one of the technique, combines both a supportive and a empathic counseling style by Carl Rogers, which he had given this client-centered therapy, which gives a consciously directive method of resolving ambivalence in the direction of change. Invariably, motivational interview has two important steps. It is focused on increasing motivation for change and consolidating and maintaining the commitment to change. That's what is motivational interview. Motivational interview is invariably brief in nature, provided in 1 or 2 sessions. It can be provided as a freestanding intervention whenever he comes in OPD, or else it can be a prelude to various other treatment approaches. It can be for medication who has poor adherence. It can be a person who does not want to undergo CBT, then you can do motivational interviewing. It has been common to combine various therapy with motivational interview. Invariably for addiction, motivational interview has been used and modified. Hence, it is considered as adaptation of MI, that is MET, motivational enhancement therapy. So, in motivational enhancement therapy, which has been exclusively used earlier for substance use by Millers and his colleagues, has found to be very helpful. Invariably, the motivational interview was started by William Miller. Later, it was modified and added by the combination of work Miller and Rolnick. They played a crucial role in developing this motivational enhancement therapy. Here, motivational interview places a strong emphasis on eliciting the client's own perception, values, and motivation for change. It is the emphasis on the patient's or the client's own perception and values and his motivation to change. It is not because the therapist has told. Invariably, that is done by Socratic fashion of questioning, by asking open-ended question. It should be the client's own want to change rather than the therapist asking him to change. Invariably, in motivational interview, if it is a success, the counselor will make sure the person who is arguing for change is the client. It's not the therapist. Invariably, it has to be intrinsic, not from extrinsic. That's what is very essential in motivational interview. It is not you be giving advice, becoming argumentative for change. Giving advice, giving lecture is not motivational interview. Motivational interview it's a collaborative work, walking with the client. In simple words, many of the researchers have said that it is dancing with the client for a change rather than fighting with the client for a change. That means it is a collaborative journey from unwanted behavior to a wanted behavior. So invariably, motivational interview shall not communicate. The therapist will not say, I have what you need. That is in CBT. I know you have certain problems. I have answer. That is not motivational interview. But instead, in motivational interview, the therapist will say, you have what you need. Together we will find it or explore it. That is collaborative. Here you are giving complete respect to the client and you are going to say that, yes, you can quit. And you have that motivation. Every human being have this. and we will together explore it, activate it, maintain it, and you will be the person who are going to make change. I am here to support you. That is what is collaborative work in motivational interview. Let's look into the definition of MI. In simple definition of motivational interview is, it is a collaborative conversational style for strengthening a person's own motivation and commitment to change. It is a simple counseling technique which is a collaborative, which is conversational, to improve the patient's or the client's own motivation and commitment to change. Let's look into the clinician's definition. Motivational interview is a person-centered counseling style of addressing the common problems of ambivalence about the change. Here, a person will say, I want to change, but I'm unable to do the change. In such a scenario, the clinician will accept, yes, there is ambivalence. Yes, there is a resistance. This is the human being who is going through a difficult time. And my job is to make sure that the change occurs. And the change occurs because of the intrinsic motivational energy or the force, so that he changes. If you look at the technical definition, motivational interview is a collaborative, goal-oriented style of communication with particular attention to the language of change. It is designed to strengthen personal motivation for the commitment to a specific goal by eliciting and exploring the person's own reason for change within an atmosphere of acceptance and compassion. That means the role of therapist is to have unconditional acceptance and compassionate. Here, the client will make his own journey at his own pace, and the therapist will be guiding him rather than lecturing him, and invariably exploring his strengths and weaknesses and his goals in his life. To achieve his goals, the therapist will guide him and empower the client to bring in changes. If you look at the conceptual framework of motivation interview, was brought by William R. Miller in 1983. Later, Stephen Rollnick joined Miller and brought in a new therapy called as motivational enhancement therapy. Here, motivational interview is one of the technique or a skill or an approach towards the client. And motivational enhancement therapy is a time-bound 4 to 6 sessions in a patient who has ambivalence and resistance to change. This motivational interview was initially started for alcohol abuse or use, tobacco use. Later, it has been used in various chronic medical conditions requiring behavioral change. For example, a person who has diabetic refuses to take medicine. Then, motivational interview plays a crucial role. A person who has hypertension, the doctor believes that he has to lose his weight, and the patient is unable to do this, but he wants to lose weight. There is an ambivalence. In such a scenario, motivational interview will bring in changes so that he loses weight. So, why need to have this motivational interview? Invariably, the research clearly indicates the people who are less motivated or who are ready to change, but who are angry, oppositional, who are unable to make changes, motivational interview plays a crucial role. For those people, invariably who requires action-oriented counseling and a goal for behavior, here is like to evoke the resistance and reactance so that the person moves towards the change. From a theoretical perspective, you need to understand change theory, which Prochaska and DiClemente had given. They talked about transtheoretical perspective. We need to know where the client is stuck, whether it is contemplation, precontemplation, preparation, action, or else he had already tried and there was a relapse. By knowing in which stage the client is there, you need to plan your intervention from there. Hence, my dear friends, knowing the change theory, what the Prochaska and DiClemente has told, plays a crucial role with regard to motivation interview. If you look at the action towards change and against change, you can see number of factors play a role, starting from not being aware that his behavior is causing problem to his health, like smoking. And a person may say he does not want to change. There is no insight, or else he may say, decide it is not at all a problem. Tobacco smoking has given him strength. He does not believe there is a problem in future. He increases his number of smoking or cigarettes, or else he makes a commitment to increase the number of cigarettes intake. So these are all may happen in the real life, or else towards change there is an awareness. He recognizes it's a problem. He wants to change, but he is finding it difficult. But there is a desire to change, and he makes verbal argument towards change, and then there is an action and the change behavior occurs. So it's a process. It's not a one-time advice. It's invariably hand-holding and mentoring a person going through a difficult journey of not motivated to a motivated, and maintaining that motivation for a long duration so that it becomes an habit and a lifestyle change occurs. To conclude, my dear friends, motivation plays a pivotal role in behavioral change by influencing the process of initiation, maintenance, and relapse prevention. It serves as a driving force behind initiating a new behavior, helping the individual to take first step towards making change, handholding him, maintaining his behavior, looking for relapse, and finally maintaining for a long sustaining period brings in lifestyle change. Once the behavior is initiated, motivation is essential for maintaining consistency over a period of time. Persuasion, monitoring, mentoring, and handholding despite of challenges or setbacks, relapse and lapse to be expected in human beings. So it is a journey of the client. I won't do it. Too, yes, I did it. Invariably, the therapist is a collaborative worker with them rather than taking a high power and advising them or giving lecture. In this journey of I want to do it, I can't do it, I want to do it, how do I do it, I will try to do it, I can do it, I will do it, and as I did it. In this process, the role of therapist is a collaborative, handholding, helping the client to know his strength, evoking his intrinsic motivation, helping him to choose what he wants in his life rather than lecturing him. So this power equation in motivation interview is not there. Invariably, if you look at the cognitive behavioral therapy or any other therapy, in the power equation, the therapist will be on the higher pedestal and the client will be on the lower pedestal. Whereas in motivational interview, they are a collaborative, they are on equal footing. There should be autonomy of the client. He will decide what is his goal, how he wants to achieve the goal, and invariably, the therapist will guide him to achieve his goal. Thank you very much for giving your valuable time. Stay safe.